Good evening to all of you, and welcome to this second episode of Assurance Talk. I am Krishna Rao, and HR professional, Manish's neighbor, and I think a great fan of him. One, of course, we know each other from the ISB days, but few things he does is very good. I mean, I think that's one of the things which has inspired me to be very closely in touch with him. So last time we did the Assurance Talk 1, and we heard a person called Parameshwaran, a person who recovered from leukemia after a 14 years struggle. And that was one of the success stories. And basically, he shared his experiences of how you could really win over some of the battles which sometimes looks very difficult to win. And I think that was a great experience to listen to. And one of the things which we are doing in this Assurance Talk is we are bringing in a lot of experience sharing from people who have gone through challenges in life. And today we have Nitika, who's here today to talk about her struggle behind success with COVID. And like last time we heard Parameshwaran. And one of the things why we do what we are doing is that it's very easy to prevent things if you just could follow a certain discipline. It is very easy to manage things just by just ensuring that you do all the right things, and a little difficult to put it in place, but if done, I think it saves a lot. And today we have the second person who's going to share the kind of support she gives, and that is Rohini. Rohini is from Give Reds, and today they are helping phenomenally for the corona patients to recover from. I mean, they bring together the plasma donors and help corona patients to come over. And of course, finally, we have Harshita Jain. She's from NanoHealth, and like at the beginning, I said I have a great admiration for Manish and the NanoHealth and the entire NanoHealth team. And I think one of the things is, see, I am currently 57 now, and I have seen the time when a heart patient would have to spend around almost 1.5 months in the hospital. I mean, my dad suffered his heart attack in 1975, and almost for 40 days he was hospitalized. And the hospital was almost 30 kilometers away from home. We were in Madhya Pradesh that time, and we saw the kind of struggle one has to go through if one doesn't know how to manage his or her health. And then later came all the discoveries of in the health sector, and we were quite excited with it. But with that also came a lot of challenges, something which we all have kind of ignored. So today, like I keep telling Manish, that the NanoHealth is like a dashboard. It tells me when I am going to run out of the fuel, or when I am going to get into the red zone when it comes, either it's a diabetes or if it's hypertension, when I'm going to get into it, and how quickly can I take preventive actions so that I'm in form. And also, a lot of people like us love to ignore all the body signs, because with so much of excitement around, a little bit of chest pain here and there chalta at times, but until unless the doctor says now you have to get out under the knife. And today I think I see NanoHealth is preventing that knife on our chest, like before his doctor cuts the skin. I think NanoHealth says, wait, we can help you out with this whole thing, and only thing is if you can just follow the precautions. So with this, I invite Nitika to share her experience about what she had to go through and all those things, and then later we will move to Rohini to talk about what is that the Give Red does, and finally Dr. Harshita will tell us the kind of scoreboard keeping that she would help us with in terms of that. Nitika, it's all yours. You're mute.
Yeah, hello everyone. I hope the weather is keeping well, everyone. I know it's raining, but then it's a bit scary also, because people have this taboo that coronavirus and all, when the weather is cold. I don't know how far it is true. For me, it was like I work in a service industry, and the biggest bank in India, that is SBI, which in itself says that I cannot avoid people. So throughout the lockdown, I was working. I had no scope of taking leaves, and that point of time, I was heading a branch, and it was a purely residential area. So people used to come in, and even if we wanted to avoid people, we were not allowed to, because people would just not listen. They wanted us to give each and every service, even during the lockdown time. Even after having a lot of precautions, taking all necessary precautions and everything, I still date I cannot figure out how I was infected with COVID. And moreover, it was like an asymptomatic case for me. Like I still remember 24th of June was the last day when I attended office, and I hardly had any temperature or any prominent symptom of COVID. Just a slight pain in my legs, and then I was like on antibiotics. And then the moment the antibiotics effect was over, again that pain used to be there. Temperature, I remember it was only for an evening, and that was only 99. So it was my husband who insisted that I should go for a test to be on the safer side, because we have small children at our place. Like we have 4 kids in our house, and they are like, the eldest one is just 12 years and the youngest one is 4 years. So and we have elderlies also, senior citizens which are beyond 66, 67 years. So because of we did not want them to get affected, my husband insisted that I should go for a test. And I just went for a test, and my report came after 5 days. And in these 5 days, I had no symptoms at all. It was like I was absolutely fine, and I was like going around to places and all. I remember when I was told about my report, I was doing grocery shopping at a store. And the moment the people from Map My Genome is the lab where I got my tests done, the lady called from there, and I was like, I did not know how to react when she told me that, madam, you've tested positive. And moreover, I was worried because there were 10 people around me. So if I tell them that I've tested positive, again, I do not know what panic they will go through. Although it was my social responsibility to tell them that, see, I have tested positive. But then I had this fear, like, how will they treat me, or how they will behave when they get to know. So that taboo, even though I am like quite educated and all, but still that taboo was there. So and the moment I reached home, it was like kind of devastating, because my 4-year-old daughter, she just cannot stay without me. So I had to tell her that you have to stay away from me for at least 14 days or something. And hats off to her that she did not enter my room for those 14 to 17 days. You cannot expect that from a 4-year-old child. And along with me, my elder daughter also got tested positive. Like she was also. So we were asymptomatic, and hats off to my husband who's taken good care of us. And along with this, NanoHealth, because the moment we got to know that both of us have tested positive, we did not know what to do, where to go, because my general physician, whom I used to consult for my day-to-day or healthcare issues, when I messaged him, he did not give a reply. For 3 days, he did not give a reply. Until date, I've not got a reply, which is not expected from a doctor. So like Praveen from Map My Genome is the one who introduced my husband to Mr. Manish, and he has really taken care of, out of the way, he has helped us. Like anything we wanted, and till date, if we ask him any help, he gives us. It's like our package is over, whatever professional relationship is over with Mr. Manish. But even if we have anything, it's not that sugar-coated words that I want to tell about him, but that is my personal experience that we have had. And during those, we had taken this 14 days package from NanoHealth, and it was like the schedule was like morning, evening, and like morning, afternoon, and evening. The doctors or their nurses would call us and take our essentials. But then even without those schedules, if I had any issue or I had any doubt, we would just simply message it, or we'll put it on NanoHealth, and they would definitely get back to us. I remember the doctors, Dr. Harshita and Dr. Chaitanya, the ones who were regularly in touch with us. And out of the schedule also, they used to chat, and they used to do video calls with us for minutes and minutes. I remember there are calls which have gone beyond half an hour also with the doctors. So my experience with this, and the only thing that I want to tell people is, even if you're affected with COVID, just stay positive. It's nothing which you cannot win over. The positive attitude is something which has really helped me, and the kind of support that these people, they have given me, especially the team of NanoHealth. Whenever I used to tell them that, see, I'm facing this issue, they used to just say, madam, need not worry. It's very basic. It's very normal. You just have to have courage, and you have to have a positive attitude. So I still tell people that if at all, there's nothing wrong even if you're affected with COVID. It's just that you have to you have to have a positive attitude, and you can win over it. It's nothing big. It's not a big deal. I know there are people who've had very severe symptoms also, and which really require medical assistance to a great extent. But still, even if you are hospitalized or anything, the first thing that you have to have is, you have to have a positive attitude, and you have to make yourself believe that you will come out of it. Until and unless you are willing to have that attitude, you cannot beat it. So that's it. What I want to tell is, and I hope it helps everyone, whatever message I wanted to convey. Thank you.
Thank you, Nitika. In fact, you just very briefly you said a few things, but yes, they are impactful. See, few things which I thought I'll also share is, whenever you go through such kind of a crisis, you need somebody to talk to, somebody to give you that assurance.
Yes.
So, like that plays a big role. And I mean, I'll share. Even I had a very similar experience 2 weeks back. I was having some fever. Okay, and I called up a doctor in Apollo Kondapur clinic, and he said, "No, we will do video consultation." Okay, and I knew there was a certain amount of hesitation for him to even see me. Fortunately, I mean, my fever and all was managed by the paracetamol, and I think I did not have any other infection, so it was just possibly a mild this thing. But yes, I think today doctors are scared, and they have to also be, because they are human at the end of the day. I mean, I think today with their kind of lack of support that they are getting, I think they also are scared. But yes, I think at that time, doctors who can possibly help you, I think makes a lot of difference. And very nicely you said, if you have somebody to talk to, I think that helps you to develop, overcome anxieties and develop positive this thing. And in fact, the other day I was telling Shrishti, my brother-in-law got infected with corona in Gurgaon. Okay, he is a CEO of an automobile company, and basically somebody who lives in a very nice apartment, in Gurgaon. There's one of the fancy complexes they live in. Yet he got it, and he never knew where he got it from. Okay, in fact, it could be the security guard on the apartment gate, or it could be somewhere he was just walking around with somebody around, doesn't know. And of course, they had to go through the quarantine, and I know what happens when somebody goes through quarantine and in a kind of an environment, they have to go through the confinement. I mean, he is a workaholic. In fact, he is from IIT Bombay, Manish. I think he passed out in 1987 or 88. And then he went to Purdue and then came back to India and started working. Workaholic, so he was finding it very difficult to stay in one room and with only one laptop and a mobile, and the food was coming under the doors. I mean, it was so difficult anyway. Good. I think that's where I think institutions like organizations like NanoHealth comes in terms of really supporting with whatever the best way they could do and collective expertise. So let us move to Rohini and understand how GiveReds is helping battle Corona. Rohini.
Thank you so much, Mr. Krishna. It's such a pleasure to be here, and good evening to all of you. Nitika, thanks for sharing your personal story. And so many members in my family have been affected with Corona, and really, I feel like we have a personal line open to NanoHealth now. All of our family members are practically directed there, and phenomenal service, guys. Really at the, like Nitika rightly pointed out, it's really about having someone that you can talk to or reach out to and know that they're trying their best. How it works out is, sometimes not in our hands, but just knowing that assurance, and rightly so, this talk is called assurance. And That's very important. And in many ways, that's what GiveRed was doing. So I just wanted to give you a brief. What GiveRed is, it's a very simple platform that connects patients to donors. And we do it via WhatsApp. So we're not an app. We made it extremely simple. What we've done is we've built a basic search engine. When we get a request for, let's say, blood donation or even plasma donation, patients trying to look for blood donors or plasma donors, our search engine essentially searches for available donors near that area and location. And we do the entire coordination and finally make that match between the patient and a donor. Because as you guys already know, in India, it's really the responsibility of the patient to get blood or blood components during the time of need. So essentially we get told, hey, for this surgery or now for COVID plasma, please procure, B+ plasma, right? And patients go haywire, the patient attendees, and in a very short frame of time, they really have to search in multiple places to try and get this. And very early on, especially when plasma therapy started, and I know the jury is still out on plasma therapy, whether it helps or not, but what we have to understand is when someone's in the hospital and when the doctors or someone say, let's try this method, everybody wants to give it a shot, right? Like we want to go all out to make sure that, if the donors are available and the plasma is available to the patient. So GiveRed really just stepped up at that point and we said that, guys, let's take this on and let's try to connect the patients to available plasma donors. So it has been a very steep journey. Blood donation is more established in India, but with plasma donation from recovered COVID patients, that was a different ball game altogether, right? People had multiple questions. Will something happen to me if I donate plasma as a recovered COVID patient? Is it safe for me to go back to the hospital? What is this process of plasma donation? So the education and the awareness curve itself was so steep for us. And GiveRed took it on because we started reaching out to several corporates in the city, like Dr. Reddy's, NATCO. That's why we reached out to NanoHealth as well, as they were managing huge amounts of patients, and we wanted to check with them to see if their patients would be open to understanding about plasma donation, etc. So we really, for the first month and a half since we started the plasma donation, our main goal was to educate and counsel more amount of donors to encourage them to sign up to be plasma donors. Luckily, today we stand where there are quite a few plasma donors. I think we have seen great amount of response, and the ratio of the number of requests to donors has been radically reduced because of several amazing organizations, not just GiveRed, that have come forward to help people out. And rightly so. I just do want to mention that the jury is still out on plasma donation. There is no evidence. It's still in experimental stages. However, I think it's more of an emotional support also sometimes. And, people want to do everything that they can. And we were trying to really facilitate that, when people come together. So how GiveRed functions in a nutshell, people can just reach out to us on our WhatsApp number, or they can directly go to www.givered.in. And there are two forms there, one for plasma and one for blood, but separately. For plasma, you can either just directly register as a donor. And if you want to request a search for donors, you can also put in a request form. What we then do is on our back end, look for donors, appropriate donors. And some of the things I just do want to mention that we put in place, there are basic eligibility criteria to be a blood donor, also to be a plasma donor. So we started baking all of that in. We make sure that before we send a donor to a particular hospital or make a connection to a patient, that they meet this eligibility criteria and some non-clinical pre-screeners, such as, are you diabetic? Are you under some kind of antibiotics, or some basic questions that they ask in the blood bank, which would prevent them from getting rejected there. Of course, there are other tests that blood banks themselves do, to make sure that, this person is eligible to donate. But The goal of GiveRed is to try and streamline that process as much as possible so that it is very smooth for both the donor. The experience is smooth for the donor and the rejection rate is lower comparatively. And we try to make the communication very streamlined, give as much information as possible, prepare the donor on what to expect. How long does it take? Where do you have to go? Like, we've tied up with many of the hospitals, not formally, but informally, in a way that it's more of an operational working relationship where everybody in the blood bank now knows about GiveRed. So we understand, okay, these are the timings of the blood banks, these are the rules, etc. So ideally, in a sense, what we've done is basically to connect plasma donors to patients in need during these times. But I would like to mention that GiveRed's main, why we started GiveRed is actually to connect blood donors, voluntary blood donors to patients, and that continues to be also our focus of work. And in fact, during the COVID-19 lockdown times, we had created an emergency list of donors, people that were willing to go even despite the lockdown and donate, because most people were apprehensive, but amazing, phenomenal group of people that actually come forward and say that, hey, please do reach out to us when there's requests, because we're willing to go forward. Manish, I believe you donated during the lockdown as well, right? Yeah, that's us. We have over 5,000 plus blood donors signed up so far. We're now touching over 400 plus plasma donors. We've received over 1,500 requests here in just from Hyderabad and Telangana, Andhra Pradesh. But for plasma, we end up getting requests from all over the country. So what we've done is we've partnered with multiple groups as well. Yes, someone, yeah. Okay. I was just saying that we believe that this is a place of collaboration, not competition. So we've partnered with a lot of other players that have come up doing similar work. And, you know, in cases where we are not able to address their requests, we, you know, try and, you know, reach out to other groups and vice versa. So I guess collaboratively, we're doing our best in every way that we can and stepping up to help out. Hopefully we, you know, have the support of all of you all to encourage more and more people to come forward and help in any way possible. But do reach out to us on www.givered.in. I guess Manish already put it on the group for anything. Happy to take any questions after, but thank you.
Thank you, Rohini. And yeah, I think blood donation has always been a challenge, not now, but for many years now. And I don't know what's really wrong there, because no one loses anything by giving blood. I mean, on the contrary, it replenishes you better. I mean, even when I was in college, there used to be such a strong appeal for people to come and donate blood, and it's been 30 years, and even still that challenge continues. I think plasma is blood donation to the power of infinity kind of a challenge. You know, like blood donation was going through so much of difficulty, so plasma certainly will have more this thing. One of the things what we are also doing during the assurances talk, and all these people who are here, is also to bring together the corporates to really look at how they can collectively support employees in ensuring their, you know, maintaining their health or monitoring their health in such a way that you at least prevent a lot of these, you know, medical leaves and also crisis. And if we can at least get this corporate, I mean, to really subscribe to the preventive support what the NanoHealth offers, it will certainly, you know, help you in developing better employee engagement. And that's one of the things which, you know, why we are doing it. And people from corporate, if you are here today, I think it's important that you take it up with your HR or the decision maker. Okay. Now let us move to Harshita. Now Harshita is a medical doctor, and she's going to take us through what Nano can, you know, help us in ensuring a effective employee health.
Thank you, Mr. Krishna, for that introduction. Firstly, I'm really privileged to be part of this talk. And Nikita, I'm really humbled listening to a live feedback from somebody whose life we have really impacted and touched. It really feels very humbled and heartening, overwhelming experience. Rohini, it was great listening to you, and I must congratulate you on such a noble initiative, and you're really actually connecting to people, which is like in a legal way. So congratulations, Rohini, on that. So hello everybody again. So firstly, even for actually coming to how we actually impact the health of the employees at a corporate setup, I would want to really give a story behind how we actually came up with a COVID solution for corporates. So if you all would be aware, NanoHealth is actually into non-communicable diseases, wherein we actually have a care pathways end-to-end management for non-communicable disease, from screening till the end of it. So one day when all of this is happening a few months ago, so Manish just comes up and he's like, I think we should do something for COVID as well. Right now our solution is ready, and I think we can make something up. So within 1 week, our technical team and the clinical team actually sat together and made the screening tool for COVID. And we were one of the first few people, even before Apple screening tool or Apollo screening tool came out. We were the first ones who were actually capturing the data digitally and telling if you're at high risk, low risk, and what you really need to do, what are the precaution steps. And then the lockdown happened, and in the lockdown, our team from all different paths spread across came up with the entire end-to-end management of the COVID solution. We were like, okay, screening is something everybody is doing, but we are not just known for screening. We are known for beyond screening, that how can we actually really manage it and also prevent it, do the entire chain. So during that lockdown phase, actually the clinical team, the technical team, the operational team came up with reading the guidelines, making the entire form so that we can screen, we can triage people, and then based on the triage, we can actually design the intervention protocol, like who needs to be taken care at the home, who needs to be going to the hospital, what are the symptoms to be captured, everything. So the entire clinical textbook or the guidelines or the protocols laid by ICMR and the government of India was translated into a technology. Thankfully, our technology was so ready and robust that it was a very easy transition. And then the operational and the clinical team actually learned how to do this for the patients, for the users. So that's how it got prepared in the lockdown. And in the lockdown, we were actually doing home care services for who were at home. We were providing home care management of COVID. And then we had the unlock 1.0, wherein offices begin to work properly, and there were certain employees coming in with restrictions, but they were working from office as well. And that's when we noticed that the cases were exponentially increasing. Even though there were restrictions, there were all of things happening, but the cases were still exponentially increasing. That's where we decided that we really need to partner with our existing corporate clients, and we need to bring our COVID home management solution for the corporates. So only then, if we can actually create for them, it'll be like a mass impact. And that is something we saw is a need, and that's where we brought in our COVID management pack to the corporate work site. So how did we actually do that? So our first step was actually, even before an employee is entering the office, we started screening the employees to really decide if they're fit to enter the office or they should be still working from home. And on that basis, the employees were allowed to come to the office. And once all the employees were working at the office, we started regularly and periodically monitoring their symptoms and capturing their data again digitally, so that we can detect any mishaps even before it happens, so that we're extra cautious, so that we can screen and detect earlier. And when anything was to happen, our system is to actually generate alerts that, okay, this is going abnormal. And that's when our team used to come in and begin the testing phase. Along with this, we even did another thing is wherein we actually partnered with another company wherein we could provide tamper-proof solution banks to the employees so that we can do the contact tracing. Because like Nikita said, she was actually asymptomatic. So there was somebody else who was symptomatic, who was affected, but was moving around the entire office, and he has infected, or he or she has infected many other people in that process. So that's where the contact tracing was something which we added, because we saw that that's a need of it and we need to complete our solution. So we needed that. And that's when we started actually contact tracing and actually monitoring them and testing them as well. That's when we realized that many tests were actually coming positive. And once the tests were detected to be positive, then we actually did the proper assessment of COVID to decide if they can be managed at home or they need to be going to the hospital. And once who were the triage to be managed at home and they took up our packages, Then, like how Nikita mentioned, that we were calling them every day, we were capturing their symptoms, the doctors were having conversation, all of that. But one major thing I would want to say here is, like, the package part might be something which everybody else is also doing it. Like they're calling, they're doing the video calls, they're managing it. But what was differentiating for us was how the technology was combined with the human care. So everything from including the capturing of the symptoms was in the technology. The video call was on the platform of NHAssurance. The doctor writing digital prescription was on NHAssurance, and the prescription used to directly go up to Nikita. So like Nikita used to, the first time when I did the consultation with Nikita, she'd asked me that, how will you send me the prescription? So I was like, just see your app. I have already saw the prescription is already on your app. And she was stunned with it. And so she was like, can I order the drugs as well? So I was like, yeah, you can just place the order and the drugs will be delivered to your house. You don't have to even step out. So it was that robust, and how everything was actually connected. To be frank, I really feel privileged that technology was added to it, because being a doctor, I'm able to see COVID patients, and at the same time, I'm not risking my life. Second, I'm actually giving a very good quality care, equivalent to anything else, just because the technology is supporting the care system. And so I really think technology was a boon for it, and connected the entire dot, everything very beautifully.
Harshita, are you speaking?
No, I'm not.
Okay. So you're done?
Yes.
Thank you, Harshita. Yeah, I think I like the way the technology and human care has come together. And I think that's the revolution part today, and it's making a whole lot of difference. So we'll quickly go to the question. So there's one question from Shailaja which says, for COVID patient, at which stage plasma is required? So Harshita, would you like to answer this, or?
Yeah, no, Harshita, I think she's more qualified, but then I can take it later based on the experience. Yeah.
So I'll start. You can add to it, Rohini. There is no particular stage wherein we actually recommend plasma. What happens is we start with all the baseline treatment, the symptomatic treatment, the management, oxygen, and still when the patient is not recovering, that's when we actually go ahead with the plasma donation option, so that the antibodies are added to the body and the immunity of the patient takes over. That's when he will start responding to the existing treatment. So that's a call which is taken clinically based on how the patient is actually progressing.
Yeah, that's true. And also, it is to mention that it is still an experimental stage. There is no, I think someone did, point out very clearly that there's no evidence on whether plasma is actually, supporting positively or not. And that's to be kept in mind. And it is usually pretty much at an advanced stage that right now doctors are prescribing plasma currently as a last ditch effort, or slightly before last ditch effort to ensure the immunity is boosted. But like Harshita clearly mentioned, I think it's so case by case basis that people, doctors are prescribing. It also depends on the comorbidities of the patient, several other factors taken into consideration before they at what stage they prescribe.
Yeah, so I would want to, before you take over, Krishna, I would want to add something to what Rohini said. Was like very important. The ICMR guidelines also kept changing with regards to the treatment protocol, how we're actually addressing or triaging or staging the patient also. And that's where I think another boost was where we used the technology, was we could actually update all of this so very smoothly and quickly. That was like the best. Like overnight, the guideline used to get changed. The clinical team used to get alerted. It used to pass the message to the technical team, and the technical team used to do its job like in matter of hours max. So that was a very good thing.
Yeah. One question from my side. I mean, I was listening to Nitika, and where she said everything was normal, and just one fine day she gets to know the test is positive. I go out. I mean, I go out to shop and walking and all those things, and life is as usual to me. But how do I know that I am carrying the risk or should I really go for a test voluntarily myself to check whether how? Is this something which one should be concerned about? So I leave it to either. So Rohini, you want to answer or Harshita?
So I'll answer that. So one easy answer would be to actually take our assessment, COVID assessment. Digitally, so that will just give you what category of risk you are in and what is the actual necessary step you need to take. But also, along with it, on like a practical level, the scenario is such that no matter you're positive, negative or not, behave like you are positive and take all the necessary precautions. You never know who is positive. It can be somebody at your home, somebody at your work, somebody outside. You can also be positive. So it's always about behave like you're already positive and take the necessary precaution and work on your immunity, because if your immunity is good enough, then you will not be succumbing. Your recovery will be easier and faster.
And what kind of precautions would you suggest?
So by precaution, all the precautions laid by the government, which is actually popularized so much, using mask like a proper mask instead of a fancy mask. Second is the social distancing, sanitizing your hands, maintaining like a healthy hygiene as well.
Yeah. So there is another question. What is the first trigger to know the patient stage is critical and needs admission in the hospital if infected with COVID?
Oxygen saturation. That's like the first trigger, and that is where if ideally normally oxygen saturation above 90 is considered to be normal, but for COVID, especially in the stage 1, is considered needs to be above 94, and stage 2 is where 90 to 94 is the cutoff. So that is where actually you need to start really monitoring it more often. You need to start making different arrangements if you need like an oxygen at home or you need to move to the hospital. So that's where the stage 2. But if the moment it drops below 90, that's where you need to move to the hospital.
Yeah, so that brings us to the questions, all the questions which has come in the chat. Anybody else would like to ask a question from the audience?
So I would like to actually add one point. So there are always a question that most of around 90% of the people are, I would say they don't need any intervention and they are okay, and why should we take any kind of treatment? Actually, in our experience, one of the things that we have found is anyone who starts actually early treatment, right? And they have been, absolutely, I mean, most of the time they have been okay. I mean, I won't claim that none of our, patients had to go to the hospital, but they have at least been okay even after they have gone to the hospital, and they have been able to return quickly. So the question that you asked about, like, when do you need it? Once you feel like you have symptom, it's better to get tested, and only having fever is not the reason why you should get tested, but there are always few more symptoms along with that. And once you do that, then the best thing is to just be safe and be under monitoring, I would say, of the doctors. I mean, it's not worth, we don't know who is the 10% who really is going to get critical, so it's just better to be safe. I mean, the way I put it, it's just not worth it. Yeah,
it's not worth it taking a chance. It's not like, this is not a gamble anybody would like to play off with. So excellent. In fact, we just have another 17 minutes left, 15, 17 minutes. Any questions? So there is one big one which has come. Thanks, Harshita. Can you tell us more about different stages of COVID? CORAD or is it COVID?
It's CORAD is right.
CORAD. Okay. How severe are they, and what medication is recommended at what stage? I have been hearing from the recovered patients about different stages, hence this question.
So these CORAD stages are actually the stages which are defined in the X-ray or like a CT scan, basically based on how your lungs are infected, how severe do you have a pneumonia. That's where the staging of CORAD has come into picture. And the lesser the number, that means less severe is your pneumonia, and it can be just like any other viral infection. The more is your number, that means more severe is your pneumonia, and more likely that it is COVID infected pneumonia, and that's where you would need like more intervention of management of COVID along with oxygen, and it might take a little longer time to recover. So that's basically how the CORAD staging works. But yeah, this staging is not the way you categorize COVID into like mild, moderate, or severe. It is basically based on clinically how your lungs are, how healthy they are, at like what risk stage they are. That is how this is categorized. I hope that answers. Let me know if you have some follow-up questions on it.
It was Karthik's question. Yeah, he says, thank you very much. I think it answers his question. Very good. In fact, it's really quite useful to me because, so much of fear psychosis is created with all the kind of misinformations today. And unfortunately, I think there has been too many product manufacturers have also created a lot of panic. I think, which I think they have just a kind of dovetailed to the crisis and created. I think the moment we hear somebody like Harshita and Rohini, I think it helps us to come to terms, and even Nitika's thing, it helps us to get a good feel. Yes, let's not get carried away by all the WhatsApp gyan that is going around, but let's stick to something which is more meaningful. Otherwise, like even the people around in the colony sometimes they just gossip around, which creates a lot of fear. Anyway. So good. I think we had a great session. But any last words from anyone? So let's start with you, Manish, and then.
No, I mean, one of the things you mentioned early on, like of course, we are all are responsible ultimately for taking care of ourselves. But how does the HR or the organization how you think can play a very important role? Like we can share some experience how we are working, and we are also aware of how GiveRed is working very actively with our corporates. But it will be good to have your perspective on that as well. Yeah.
So in fact, I think last assurance talk also I talked about it. The Parmeshwaran went through a standard medical examination, like we do like periodic medical test, and so doctor suspected something, and he said he wanted to do some further test, and then he found that he was carrying leukemia in him. Like it was infected, and then it was AstraZeneca that he was working for, and I was also there as the HR manager, and we put a thorough process around him, helped him out, including he went for a bone marrow transplant, and 14 years later he is completely zero. There's no trace of it. And during the tenure, he never compromised with his career as well. In fact, today he's the CEO of a pharma company. That time also he was doing a course in Warwick, and then he was also reporting to Sweden, and who'd be in Sweden almost every quarter. Okay. And then I have a couple of more experiences. One negative experience is a very senior marketing professional was kind of doing a 10,000 crore business annually in India, diagnosed as a high-risk heart patient, never bothered. Okay, basically he never got time. He never had time to really go through all the restrictions and all the things. And one fine day he suffers a heart attack, and then he gets into it has to be a bypass surgery, and he's hospitalized for almost. He was asked to be on rest for more than 3 months. Company replaced him. Well, we can't have the business hanging for 3 months and without the head. And somebody came in, took over his work. He came from the US, took over his work. And after that, he was made to manage corporate communications and all those things because that was a lighter job. The entire career collapsed. Okay, so this is a negative story of where you just failed to prevent. If only he had taken enough care today, I think he would have been much better off. Okay. So one of the things which I have always insisted in wherever I work was a medical test is mandatory. And in fact, one such case was that, in fact, he has agreed to come on an assurance talk as well. Another HR colleague from one of the pharma companies, he suffered he went for a medical test, diagnosed this as a high-risk patient, heart patient. And one fine morning, early morning, he suffers a severe chest pain, and his wife did not suspect it must be out of gastric problem and all those things. Immediately called the ambulance. He was in hospital, and that is where he suffered a heart attack. I mean, when he suffered a heart attack, he was there in the hospital, in Apollo Hospital, Jubilee Hills. And I think that is where I saw a huge value this medical preventive things or medical test helps it. And like I was telling earlier, we rarely monitor, we rarely keep a track of anything. I mean, in daily life, I really don't care how many pizzas I eat or how many drinks I have, but it's only when the doctor kind of scares me up, and that's the day when I kind of wake up. But I think that's what I keep telling Manish, is that the moment you have some kind of a dashboard in front of me, either weekly or monthly, if I get to know where I'm heading for, it really helps me to take precautions, and stay safe, And that's where, and I think HR as a function has a huge responsibility in ensuring that they get their medical thing in place, the medical test and medical checks in place. Otherwise you end up losing a talent because of a bypass surgery. Okay, and sometimes it could be a serious business loss. I mean, I know when this gentleman suffered a heart attack, I was there in the company heading the HR, and my CEO calls me and says, we need somebody because he's not going to be there for next 3 months. What are the next choices? What is the next choices for the next 15 days? Fortunately, we had a succession planning in place. We could bring a person there. But just imagine an organization we did not have, the business would have just collapsed. And I think that's where the HR can play a very strategic role in ensuring the business continues. So, I mean, that's one thing which I keep telling all my HR colleagues. Yes, Rohini, would you like to add a few last words?
Sure. And in fact, tying very well into what you just said, I think HR plays such an important role in the companies, obviously for companies' welfare. The employees' welfare, so that they contribute well to it. But I'm also seeing beautifully how HR is contributing for the companies' employees to give back to societies as well. Like all of the big companies are having amazing programs that give back in many ways. We ourselves had the privilege to partner with several corporates where they have programs like the Spirit of Giving, wherein they are partnering with us, companies like Infosys and Dr. Reddy's, so many, for employees to actually have access to transparent platforms like GiveRed and many others, for them to be able to give back to society, but also use the services when, their loved ones are needed. So I guess my, what I would like to say is that I think, HR has a great role. Companies, corporates have huge responsibilities, and I think they're taking it on amazingly during the times of COVID, to keep their employees safe, but also keep their communities safe. So, GiveRed has been actively partnering, and I feel like there's a great synergy that's going on with everybody coming together to help out. So I'm really grateful for that, and thank you for today.
Thank you, Rohini. Harshita.
You three have added the perspective on HR. I would want to instead add perspective of employees. So HR might take the plan and actually start that for their office, but unless and until employees participate proactively, it's not going to be success. And that is somewhere I think employees need to also take that initiative to come forth and take proactive steps for their health. So right now, as long as you're healthy, you've not developed any complication, you still have the power of choice that to take the action or not. Once you've developed the complication, you lose out on the choice. Then it's just whatever you've been said to do, you'll have to do. So it's better to use your power of choice and take proactive steps towards your health.
Thank you, Harshita. And folks, there is one person who's been very quiet, but the force behind all this assurance talk is Shrishti. And Shrishti is somebody who kind of puts together everything, gets everything done, and very silently is leading. So Shrishti, we would like to hear something from you as well.
No, I think thank you to all our fantastic speakers for such a wonderful session. I think we can see in the comments that people have really have got good insights from this session. So thank you for sharing these insights and making people more aware towards their health and well-being, and obviously spreading this broader message of corporate health and well-being for employees as well, because that's why we started this session and this series, to be able to take health and well-being to corporates and engage and have a lot of important conversations that get missed out in all the noise that we often encounter. So thank you for being an engaged audience, and this is only the second episode, so we hope to create a lot more and look forward to hosting you all even more. Thank you, Krishna, once again for being a fantastic moderator.
Thank you, Srishti. Srishti was very humble in saying what she said, but I think she is the force behind this assurance talk. And I think today, if we are doing the second one, is because of the way she pushes hard. She puts together everything. Okay. And thank you all for such a lovely evening. And like I always say that I am never surprised with the number of participants they come. In fact, today morning also I was telling Srishti the same thing. If I talk about, say, business process re-engineering, I will get 100. But if I talk about health, I will not get many. And that's one of the biggest fears I always carry. And because health is still not a priority, at least in our country. And second thing is that, and that's one of the reasons. I mean, I'm not surprised with the way the COVID numbers are increasing, because today nobody wears mask outside. I mean, if you step out, and I think so. Having a very few people, I'm not surprised. But yes, what I insist each one of you is to go and motivate few more people to at least come forward, spend an hour with in talks like this, so that you are able to prevent or protect somebody somewhere. So thank you all, and good night.
Krishna ji, can I speak a few words?
Yeah, Pravina.
This is Pravina Tota. So as you rightly said, though people have joined in or not, immediately, I've shared on to my Women in Vision page just now all the, Facebook links and what all you shared here. Definitely it reaches the large audience and they are really in need of it. And I was surprised, even I was not really aware of all these things. Thank you so much. Now, because as you know, Women in Vision has more than 2,000 women. And so I'm a big networking person, no doubt about it. Because yesterday itself, someone was asking me, Pravina, my husband got corona, what do I do? Then I could give them municipal councillor numbers as well. Now I'm more equipped. I can give these numbers as well, these contacts as well. Thank you so much.
Thank you, Pravina. And Pravina, please be our ambassador. Please be our champion.
Definitely. I've already started doing that. Thank you so much.
Pravina, just one quick note. We will be sharing the recording of this session on our page as well. So feel free to share that in your group as well.
Yes, I'll do that. I'll take it from Krishna ji and I'll do that. And I've liked your pages and I have already shared onto my page. And what I'll do is I'll keep watch party and whatnot. We'll do that. We'll create a buzz. Definitely.
Thank you so much.
Thank you.
Hi, one quick word from my side, Karthik this side. I think you guys are doing a phenomenal job. It's just that probably Manish, I know you. I work with ISB. I know Krishna sir. So we'd all together worked in a group. So may not have met you then, but I know the work you guys are doing. So it's fantastic, and it has to sort of be marketed across. I think that's what is right now. Not many of us are aware. So I think it's important to sort of spread the word, and we will from our side, in our capacity, we will do that. And I'm sure I wish you all the very best, and you guys are doing a good job. I just wanted to put a note on that and end it here. Thanks.
Thank you so much.
Thank you. So sweet of you, Karthik.
Thank you, sir.
So shall we close the day then?
Thank you, everybody.
Thank you. Good night.
Thank you.
Bye.